because you and I often don't have that luxury. Many times, your second and third opinion, my second and third opinion, it's been going on for quite a while, whatever is going on, and then we finally get this animal. Let maybe just a minute talk about recognize this in the young. And we
Mhm.
we may also allude to the cat situation there too, because as you know, so many of our cats have OA, have osteoarthritis, but they don't show it because they in the wild would get eaten. So they're not going to show it at home sometimes too.
Yeah. Well, you're singing my song, so thank you for asking this question. It is
Of
so
course.
near and dear to my heart because I entered veterinary medicine as a pet parent. I truly didn't know. Randy, I did not know that young animals have arthritis, right? In my mind, it's very old thinking. In my
Yes.
mind, arthritis is an old person, horse, dog, cat disease. Here's the crazy part. It turns out arthritis comes from instability. And the most common cause of joint instability in animals, particularly dogs, is what?
It's usually genetics,
Dysplasia.
right? Yeah.
So it
Oh, okay. Well,
means
you're talking
that
about exact. Yes. Okay.
genetics,
Right.
genetic hip dysplasia, elbow dysplasia,
Right.
spinal malformation, right?
Right.
You hit it. And so what does that mean? Holy moly. What does that mean? It means that a huge percentage of our patients, like 80% of them, have not had arthritis as an old animal, but their whole life, which means that they are coping with this with a bright and shiny smile their whole life until they can't. And then what happens is they come to us and it's hard. It's hard to see them in dysfunction. It's hard to feel like they're failing the animals, right? And so we have now, say, a 12-year-old dog. And really, there's a lot of things that we can and could have done. But at this stage, it's not going to give us as much for our effort and it's going to cost more.
Yeah.
So we start having
Yeah.
this discussion around, well, is it even worth it?
Yeah.
And that is my least favorite conversation.
Oh
So my
yeah.
favorite conversation, if there is one around arthritis, is unfortunately is hard to tell an owner that their puppy has elbow dysplasia, right? But my favorite is really if we can get it this early, like what are some of the things that you do in your practice for dogs who are young to middle-aged for arthritis that's kind of special and makes a difference? What do you use?
Well, I start at the beginning of foundational medicine, and so I'm working on my first 20 minutes of any conversation is typically diet, because I want I want no inflammation in this animal's body because that only spurs the pain response and makes things worse. And so, getting soy, corn, wheat, rice, white potato out of their diet. I look at the Chinese principle of thermogenic properties of food and getting lamb and veal and also chicken out of their diet. People don't realize chicken can be in hot meat, helps. And I go to the conversation of supplements. So that conversation happens before we ever get to the other types of things that you and I do to help these animals.
Absolutely. And the other thing that we really do know, right? There's all these, it's tricky because then sometimes with the clients that are really invested, it's like, well, what really works and what should I be doing and how do I make this perfect? Gosh, we're never perfect. What we do know is the most important thing is that we don't overfeed them in general, right? If we can keep their weight down, and especially if we already know they have arthritis, right? It's been proven that a normal weight dog, they did this in labs, old study, right? Purina study, normal weight dogs with hip dysplasia versus obese dogs, same family with hip dysplasia. Those dogs that are overweight get 6 times more arthritis,
Yeah, yeah,
right? And so
absolutely.
arthritis is not a certainty. That's what we
Right,
need to know. Some
right.
animals get arthritis, people get arthritis in different places in their body, right? So we need to be thinking about holy cow, if we get to these animals early in their life, we can help them rebuild their body, keep their symmetry, maintain their muscle flexibility and range of motion, and all of the things that reduce friction
Yeah,
and create arthritis, right?
yeah,
So yes, my favorite conversation is to start helping with regenerative medicine, with diet, with rehabilitation in these patients that are maybe a couple years old. We know
Sure.
they have a clinical problem. We
Sure.
know that it's worth working on. We know we're giving them their best quality of life at their peak performance, right?
Yeah. Yeah.
So it really is, there's a sweet spot, and it does make that conversation a little easier for all of us to take, right?
Yeah. It's always difficult.